Hello, my name is Vanessa Shore-fritz, and this is my pathogen presentation on rabies. Rabies is caused by the rabies virus, which is a member of the genus Lyssavirus of the Rhabdoviridae family. It is a rod-shaped or bullet-shaped enveloped RNA virus that is approximately 60 nanometers by 180 nanometers. Its envelope contains a lipid bilayer with glycoprotein spikes embedded in its membrane, which allows the virus to attach to its host. It also contains a helical nucleocapsid, meaning the RNA is tightly coiled into a spiral or helix with protein subunits, known as capsomeres, that wrap around it in a helical pattern. Rabies primarily affects the nervous system, starting with the peripheral nervous system and spreading to the central nervous system. The virus often enters the body through the bite of an infected animal. It enters via neuromuscular junctions and muscle tissue near the site of the wound before spreading to nerve cells. It moves through the nerves towards the brain, where severe damage occurs. From the central nervous system, the virus spreads to other organs, such as the salivary glands. Signs and symptoms typically occur in 5 stages. The incubation period generally ranges from 30 to 90 days, but can be as short as 5 days or as long as over 2 years. In addition, children or those bitten near the head or spine may experience shorter incubation periods. The prodromal phase lasts 2 to 10 days. Early symptoms often include general malaise, fever, and fatigue. Other symptoms may resemble respiratory issues like sore throat or cough, gastrointestinal issues like anorexia, dysphagia, nausea, vomiting, diarrhea, and abdominal pain, or central nervous system issues like headache, vertigo, anxiety, or irritability. Pain or tingling at the bite site can also occur and, when combined with a history of an animal bite, should prompt suspicion of rabies. The acute neurologic phase includes clear signs of central nervous system dysfunction and are classified by 2 forms depending on the dominant clinical symptom. Either furious rabies, where hydrophobia, the fear of water, is the dominant symptom, or dumb rabies, where paralysis is the dominant symptom. Other features of either form include fever, hypersalivation, convulsions, and difficulty breathing. Coma and death are 2 separate stages but go hand in hand with each other. Rapid, irregular breathing leads to paralysis, coma, and respiratory failure. Ventilator assistance may prolong survival, but the disease is nearly always fatal, with only 7 documented cases of survival in the US after symptoms appear. In addition, I also find that the hydrophobia symptom of rabies is really unique and interesting, so I've decided to include a short video clip to indicate what that might look like. Rabies is found almost everywhere in the world, except in a few places where it has been wiped out or never existed, like some islands in Australia. The highest risk areas are in parts of Asia, Africa, and Latin America, where rabies in dogs is common. In the US and Europe, rabies in domestic animals, like dogs, was greatly reduced through vaccination programs in the 1940s and 1950s. Today, domestic animal rabies makes up less than 10% of all cases. However, rabies in wild animals, like raccoons, skunks, foxes, and bats, is now the main concern in the US. Although human rabies is rare in the US, about 90% of recent human cases had no clear history of contact with rabid animals. This could be because the exposure wasn't noticed or properly investigated. Worldwide, rabies in humans is almost always caused by being bitten by an infected animal. Non-bite exposures, like coming into contact with saliva or scratches, are extremely rare. Rabies remains a major problem in developing countries where the disease can be fatal in almost every case once symptoms appear. Rabies is primarily a zoonotic disease, meaning it is most commonly transmitted from animals to humans. Again, it is typically spread through the bite of an infected animal. Although non-bite exposures like contact with saliva, scratches, or mucous membranes are rare, they can also potentially transmit the virus. In addition, rabies does not usually survive in the environment for long periods. The virus lives in infected animals such as wild carnivores like raccoons, skunks, foxes, coyotes, and insectivorous bats. Vaccination of animals, especially dogs and cats, is key to controlling the spread of rabies. The transmission of rabies is similar to its pathology. Again, rabies is transmitted primarily through the bite of an infected animal, with nearly all human cases resulting from this type of exposure. Non-bite exposures, such as mucosal contact, rarely cause rabies. I'm seeing a running theme here. The virus may enter the body through the neuromuscular junctions, moving to the central nervous system and spreading to other organs, including the salivary glands. Transmission can be prevented by vaccinating susceptible animal species, especially dogs and cats, which has greatly reduced human rabies cases in certain areas. In regions with high wildlife rabies, such as the United States, oral vaccination programs for wild animals help control the disease. In addition, there is no cure once clinical symptoms develop. Rabies infection does not have specific antiviral treatments once clinical symptoms develop. However, post-exposure prophylaxis, also known as PEP, can prevent the disease if administered promptly and properly. PEP consists of a thorough wound cleaning, administration of the rabies vaccine, and administration of human's rabies immune globulin, also known as HRIG. Two vaccines that are licensed for use in the US are the human diploid cell vaccine, known as the HDCV vaccine, and rabies vaccine absorbed, known as the RVA vaccine. These vaccines are effective in preventing infection. There is no known cure for rabies once symptoms appear, and death typically follows. However, post-exposure treatment with the vaccine and HRIG can effectively stop the infection if administered before clinical signs develop. Rabies vaccination for animals, especially dogs and cats, is crucial for preventing the spread of the virus. Vaccinating wildlife populations through bait containing oral vaccines also holds promise for controlling rabies in wild animals. Rabies infection does not provide lasting immunity once it has progressed to clinical disease, especially since it usually leads to death, but vaccination before or soon after exposure can induce immunity. Those who recover from rabies are extremely rare, with again only 7 documented cases after clinical symptoms have appeared, and immunity from these natural infections is not guaranteed. There are 3 common laboratory methods that are used to diagnose rabies. Number 1, direct immunofluorescence tests. This is one of the fastest methods for diagnosing rabies antemortem. It is typically performed on a skin biopsy from the nape of the neck to detect the rabies antigen. It is the most sensitive and specific method, though results may be negative in the early stages of the disease. Number 2, virus isolation. The rabies virus can be isolated from saliva by inoculating neuroblastoma cells or laboratory rodents, especially during the first 2 to 3 weeks of illness. Number 3 is the rabies antibody detection. The presence of rabies neutralizing antibodies, typically detected through the rapid fluorescent focus inhibition test, also known as RFFIT, is diagnostic. The detection of antibodies in cerebrospinal fluid further confirms the diagnosis, although it may appear later in the disease. Recent studies have shown progress in rabies prevention with a new single-dose vaccine called, and I hope I pronounce this right, ChAdOx2 Rab-G. This vaccine uses a modified common cold virus called